Welcome to Period Stories. My name is Dr. Asensio, and today we'll be talking about sexually transmitted infections. This is a part 4. We're talking about human papillomavirus, also known as HPV, a viral sexually transmitted infection. What is HPV? Well, it is the most common sexually transmitted infection, and it usually is harmless. Our bodies usually clear the virus by virtue of our immune systems. Some types can lead to cancer, others to both common and genital warts. So when we think about HPV, we think about the high-risk type of HPV as well as the low-risk type of HPV. Now, the low-risk viral infection usually causes warts. Those can be common warts, which occur in the hands, feet, or other parts, and then genital warts, which are usually sexually transmitted. Then the high-risk viral infection usually over time can lead to cancers. Now, HPV is usually passed between people through skin-to-skin contact. There are over 200 varieties of HPV, with over 40 which are passed through sexual contact and can affect your genitals, mouth, or throat. The most common sexually transmitted infection in the United States, and it's spread through vaginal, oral, or anal sex with an infected person. Most infected people have no signs or symptoms. Now, in terms of the low-risk HPV that causes warts, these are just some examples of different warts here. The HPV virus invades the skin, and then the DNA from the virus enters the skin cells. It replicates, and it causes that infected skin cell to multiply and form warts. After this, the virus then can shed and pass on to other areas and to others. High-risk HPV can cause cervical cancer. Additional cancers caused by the virus are cancers of the vulva, vagina, penis, anus, or back of the throat. Cancer often takes years, even decades, to develop after a person gets infected with HPV. Now, HPV definitely affects the cervical cells. High-risk HPV infects the cells of the cervix in women and over time can cause changes, persistent infections, and this can lead to cancer over time. There are currently no screening tests for men, and we can detect the HPV in women when we test the cervical cells when we do the pap smear. Now, our gynecological exam, usually done annually, would be a time to examine a woman with her pap smear, and the recommended age for start for pap smear will be about age 21. Now, cervical cancer was a major cause of death for women, but the incidence has decreased with screening tests, and HPV being the main cause of cervical cancer, prevention is the best treatment. There is no cure. Now, in terms of managing warts and genital warts, they may go away on their own, but it may take months or years. So during this time, further spread could occur. So some patients opt for topical creams, acid treatment, freezing, or surgical removal. Now, let's talk about the HPV vaccine. Currently available, we have Gardasil 9. This vaccine protects against 9 strains of HPV. Included in this are HPV 16 and 18, 2 types that cause approximately 80% of cervical cancers. It is recommended for everyone through age 26, if not previously vaccinated. Recommended for girls and boys 11 to 12 years old, and can be given at 9 years old as well. 2 doses are given 6 months apart when given if you're younger than 15 years old. And if you're 15 years and older, you get 3 doses of the vaccine. Now, in adults, if you're older than 26 years old and never previously vaccinated, it may be a benefit. 27 to 45 years old, You may also choose to be vaccinated. Benefit is less clear, but especially in patients who've had abnormal changes on their pap smear, have had loop electrical excision procedures or other procedures, this would be recommended for you to have the vaccine, decreasing the risk of there being recurrence of these abnormalities. How does the vaccine work? Well, like most vaccines, the vaccine is injected into our body. Your immune system responds to the vaccine by producing antibodies to fight the virus. And these antibodies build up in our bodies without causing an infection. The antibodies then act to fight the infection when it presents itself to our body and removes the virus, building immunity towards HPV. First vaccine given in the United States was about 2006, and HPV infections and cervical precancers, the numbers have dropped. I hope this was helpful. Subscribe to Period Stories. Thank you.